Record-breaking case numbers continue to climb, pushing the state's ambulance system to near breaking point.
We as an organisation experienced a surge in demand that we haven't experienced before.
On Monday, ambulances were ramped outside hospitals for about 330 hours, a figure close to that recorded in the entire month of April in 2017. Combined with a significant jump in 000 calls, the state's ambulance service was left to take an unprecedented step, directly warning the public of delayed response times.
What we're seeing now is the direct effect of reducing restrictions when you're on the plateau phase of a pandemic.
Among those direct effects are a significant number of hospital staff unable to work, either as positive cases or close contacts.
20% of our medical staff have been off, and that's not unusual across the board. There are wards where they're just about scraping by in terms of staffing levels. So that's the biggest factor.
Just today, we have 2,200 staff who are not at work because they are COVID positive or close contacts. That's putting enormous stress on the system.
The Premier says the government has committed to solutions, but even with another record surplus on the horizon, he acknowledges little can be done to ease the pressure now.
That's hard to avoid, and it's hard to fix at this point in time.
This points to 5 years of underinvestment in our hospital system, a government which has cut corners in our capacity, and it points to a hospital system which is in crisis.
Mr McGowan was also on the defensive over a new bill being rushed through Parliament. Under changes to the Emergency Management Act, the government was given broad-ranging powers to impose health restrictions under a state of emergency in response to the pandemic. Those powers had been due to expire in July. The government now wants them available until at least January of next year.
We've had advice from the Police Commissioner, the Chief Health Officer, that it's required.
We are greatly concerned that the government have avoided a lot of scrutiny on the decisions, and this is just a way of them continuing to avoid public scrutiny of their decisions.
The Premier says the powers are only available during the state of emergency, which could end before January. Kian Burke, ABC News.